Recording. Hi, everyone. Can you hear me? Yes? All right, cool. Just a few updates for today. Let's dive in. We have 241 confirmed cases now and 9 fatalities, which is a big jump from yesterday. A couple of things I wanted to highlight before opening up to questions. So we've continued to have some complaints about, in particular, grocery stores. And the governor issued an order requiring stores to cap occupancy at 50% of store capacity, to clearly mark 6-foot spacing in checkout lines, and also to encourage spacing outside the store of 6 feet as residents wait to get inside the store, to put up signage, to have one-way aisles that are conspicuously marked inside the stores to facilitate the flow of individuals while promoting social distancing, and to install plexiglass shields to separate employees from customers at checkout lines where possible. And we want to underscore just how important it is for stores to be abiding by this. Yesterday, I put out a robocall to all of the grocery stores that we identified that or that we have on our list to outline some of these procedures. And our health department is going to be conducting inspections of stores to make sure that stores are following this. We are prepared to close down stores if this continues to be a problem. It's obviously critical that uh, stores are promoting social distancing, and these are vital assets for the community right now because of people needing food. But we need to do so in a healthy way. And so we're putting out a strong call to grocery stores and corner stores to abide by this guidance. Um, just a couple other notes. We'll be transferring another large group of individuals experiencing homelessness tomorrow to a hotel. And this will complete the overall kind of move to close the large homeless shelters and move people into hotels so that they're not living in very close quarters together. The next hotel that individuals will move to is in West Haven. Um, and the only final thing that I have is I wanted to encourage people, in particular now. Now is a very important time for people to just hunker down. And when you think about the trends that we're seeing in New York City, and every day how our numbers are increasing pretty dramatically, this is a time that we all need to make sure that we're paying extra special attention to not contract the virus ourselves and not promote spreading it, because this is the time when we will be setting up our hospitals for the potential for them to be overwhelmed. When you think about it, if I go out to the store and get close to other people and contract the virus now, it could be another week, maybe even 2 weeks before I start to get symptoms. And that's about the time that we're predicting in general that the healthcare system is going to start to really feel the pressure. That's the last time when then I want to go to the hospital, that anybody wants to go to the hospital, because we want to make sure that everyone has the most care possible. And so I'm encouraging people in particular, please be cautious right now. Obviously, we need to be careful. We need to be careful for many months. But in order to flatten the curve and reduce the load on the hospitals so that we don't have a situation like we're seeing in New York, where they're only days away from not having enough ventilators, where they are strained about the number of beds and healthcare staff that they have. This is a time when everyone in the public really needs to be careful and do as much as possible to reduce their interaction with other people. Do uh, any folks on our team here have anything they wish to add before we open it up to questions? Everyone sounds good. Questions? I see Mr. Bass here. Gage, I don't have control over unmuting people, so
I'm
you'll.
unmuted. I'm okay. You did
All
that.
right, good.
Thank you. I just had two questions. One is, you mentioned a few days away on the ventilators. Do you have specific updates on how close we are to running out of ventilators or beds at the hospital?
No, no. The hospital, I think we're not close to that right now. The governor of Governor Lamont mentioned that Connecticut should have more or needs more ventilators. So I know that it's overall a major concern, and probably one of the most important as far as our limitations right now. But I don't have specific numbers on it.
Gotcha.
I would encourage you to ask the hospital that question if you can get in touch with folks there.
Thanks. And the other question, my guess goes to Maritza, is these three latest people, besides their ages, if we could tell if they had underlying conditions and if there's anything else you could tell us about who's dying. Is it a cluster from any workplace or social event? Is there any particular hotspot that we're seeing the outcome from?
Our most recent, so that's a good question, Paul. So our most recent, the youngest is 42, ranging to 93. They're not linked together, and it's a combination of the mortality of elderly and underlying conditions that existed. In regards to positive cases and what we're seeing, there are certainly different areas within New Haven that we're seeing greater positive cases. We are now assessing that data very closely so that we can engage our leaders and have a robust conversation about public health intervention and messaging around that. So that's really critical. Our youngest positive case at this time is a year old. And so it's really ranges from as young as 1 in New Haven to as old as 93.
Thank you. You talked about which areas are showing more. ProPublica had a story today that the African American community is getting slammed disproportionately. The people who are dying and getting infected, that once it hits a city, pretty soon it's hitting the African American community hardest. Is that happening here? Or is there anything else you could tell us when you said that there are trends that you're seeing a greater preponderance?
And this is affecting all communities, regardless of race, gender, and social economic status. So I just want to be clear about that. I
Mhm.
know that there's been some articles I've been reading that this is hitting one race over another. That is not the case here in New Haven. It's a broad range of individuals that are affecting in almost every community at this juncture. There's some communities that have higher cases than others, and that's something that we're looking at very closely to develop public health interventions for.
What are those communities that have the higher?
Once we really analyze that data, I'll be providing an update on our next press conference.
Thank you.
Other questions? Let's go with Shayna and then Michael.
Thanks for taking my question, Mayor. As far as you know, I believe it was last week when we spoke about the parks and different places where people tend to gather. Has there been any update as far as how the enforcement of the social distancing practices have gone in playgrounds and parks in New Haven?
Generally, I've gotten positive feedback, although yesterday we had an issue in East Rock Park. We closed the park and put a chain across the entrance, and we had many, many cars that were parked all along the entrance road. And, we're struggling with what the right thing is to do here. It's nice that people are out enjoying the park and staying away from each other. But at the same time, when there's large groups of people that are parking all in the same area and really close to one another, that's not ideal. So in some cases, we're struggling with what the right way is to balance making sure that people are able to get out and exercise a little bit in a safe way, but also making sure that people aren't congregating together. overall, we found that there's not a lot of people. We haven't gotten a lot of complaints about people using playgrounds and those sorts of things, which we're very happy about those results.
Gotcha. And I guess another question I have for you, how has the communication been with the governor and leaders at the state level? I know it's very collaborative with the mayors in town and trying to curb the transmission of the virus from town to town, with it being so overlapping at this point. But what's your communication like with the state, and how is the state really helping with the jump that New Haven seen with just within a day?
I think it's generally been quite good given the circumstances. Things change so quickly right now, and it's difficult for everyone to always be communicating across or with the right people. Generally, we've been quite pleased with the state's effort to communicate with us. Occasionally, there's something that we don't hear about, but they try to fix that communication gap pretty quickly. And you know, I think similarly to my hope for people in New Haven, I need to be, and I think our team needs to be flexible with the state, that sometimes they may need to make decisions pretty quickly and might not be able to notify us right away. And so we're trying to be flexible with them, but overall, we've been quite pleased.
Gotcha. I guess I have one more question pertaining really to the circumstance of low-wage workers in the city. I know Board of Alders had voted in favor of supporting low-wage workers in New Haven that are out of work or have their hours cut. How is the city, I mean, I guess my question is, has there been a conversation as far as how the city is going to support that measure?
The short answer is yes. We're grateful that the federal government and the state have both issued some support packages to support local businesses and also to support individuals that are currently unemployed. There's some incentives for businesses to rehire people, which is really important. And we're exploring some potential options on the city level as well. Um, it, One of my main concerns is people that are not eligible for some of the benefits, and in particular the undocumented community. So we will be having some conversations, not just internally within City Hall, but with some local funders about potential ways that we can help support people through this time.
And is there any, I mean, how for local stores that are still open, I mean, grocery stores, your bodegas and corner stores, and if they're not practicing the social distancing, or if they can't, like, is there any assistance that's going to be given to them to do things like add the plexiglass or, you know, those other measures that maybe other bigger corporations are able to take?
My understanding is there's no financial assistance for that. A lot of these are pretty low budget things of signage and arrows. I think, and you should confirm this, but I think that the governor's order says where possible as far as the plexiglass in infrastructure. The goal is to keep people, oftentimes who are very low-wage workers, who may be cashiers, for example, keep them safe as well if they're interacting with many people that are coming through the store every day. There may be other solutions, and instead of setting up plexiglass, of having people a little bit more distant from each other that are working in the facilities.
Thank you, Mayor.
You're welcome. I saw a question from Michael.
Good afternoon. I also had a question about the executive order on the grocery stores. Are the calls or complaints that you've been getting in the 2 days that it's been in effect, are they from consumers about the stores? And if it's so, is it about the stores that are not enforcing it, or the stores maybe that are enforcing it and the consumers don't like having to stand in line outside the store?
Well, I have heard zero complaints from anyone who feels stores are over enforcing. I've heard a number of complaints from people that have visited stores where they feel almost forced to be in close quarters because the stores are not enforcing the 6-foot distance in lines, for example. The stores are not enforcing the one-way directions for grocery store aisles. And my sense is that the main issue here is that the stores are, many of them are installing the signage, but that they're not having employees remind people that they have to, that people have to stand 6 feet apart, that people have to go a certain way. I think that this is a big cultural change, and the stores need to actually assign employees to make sure that they're reminding people to comply with these directions.
I'm imagining that most of the stores that you've gotten calls about are smaller ones. I can't imagine that Ferraro's Market or Stop and Shop doesn't know about this, but the guy with the corner store, the bodega, might not know about this. Is that possible, I guess?
We've gotten complaints from about small and large stores.
I understand. Thank you.
Yep. Other questions? Before I forget, tomorrow is my wife's birthday, and so I'm hoping that we can not have a press conference tomorrow. So we might see you guys in 2 days rather than 1. Thanks, everybody. Take care.